Yeah, good afternoon. And thanks, Dr. Rajendra ji. Um, I'll start with one sentence that actually I envy your passion on this health related initiatives which you are taking. I wish I also had the time and that passion to do that. But someday I'll certainly join you once I'm free from the current responsibilities. Keep a position.
I hope you don't get free.
Yeah.
We need you more.
So, both my colleagues here in the panel, they have brought very important points. But we have to appreciate one thing, that Dr. Srivastav, from a government background, now working with NGO setup, whatever he said is more from the point of view of providing the healthcare to 1.4 billion people. Because this big country with big population, we still have to provide good healthcare to each and every. And when you think of the end of the mile, rural India patient, the ecosystem is maybe a far away concept for them. They probably need the basic healthcare system, and that's where the government today is working very strongly. A strong push through different schemes is happening. Having said that, what Dr. Rao was talking about is a part of the new India, and a lot of things are actually happening on that end, where the ecosystem is being tried to get developed. But ecosystem, when we talk, as the word itself talks about, it involves a lot of stakeholders. There are multiple stakeholders in that. And when we talk of a patient-centric ecosystem, the patient is at the center. The need of the patient is at the center. And interestingly, this model has, the patient has dual role. One, it is at the center of the whole ecosystem. And second, it is also part of that ecosystem and plays a dual role, which is contextual. In one context, when others are looking at the need of the patient is at the center. But when patient becomes part of the ecosystem and starts asking and demanding, then it becomes a stakeholder in the system as a participant in the development of the ecosystem. So, as others, there are many stakeholders. The government is a stakeholder, the private industry is a stakeholder, the hospitals are stakeholders, NGOs are strong stakeholders, the regulators are strong stakeholders. So a lot of changes, when we talk of innovation in this whole space, a lot of things are happening at the private industry level. The startups are actually working in this domain very strongly. Government of late has also started participating in developing this ecosystem. Some of the examples Dr. Srivastav took, the facilitation from the insurance point of view is actually a strong push from the government to develop that ecosystem. Till some time back, it was patient and doctor. But now today, when we see, we have many more stakeholders coming into that whole dynamics and trying to develop that ecosystem. Regulators, from where I come, we also are a strong part of that. But what I have seen this organization, and I can see that difference coming from my previous role with the private pharma, corporate pharma in this company, in this country, I can see that the difference of mindset between the regulators and actually the corporate setup. We think completely in a different way, where the patients many a times get a backseat. I'll give a very simple example. A couple of days back, I was looking at a file and I saw that there was an old lady who had applied for, she just wrote a letter to CDSU, my organization, that she needs a specific drug to help her husband, who is a patient, is a cancer patient, late stage, and that drug is not available. She wanted some help. So that file, when the letter came, my organization, as they normally do, They took it as any other application, and notings started happening that it should go to ministry, that this is not our purview. It is, they want some financial help. It is not in CDS's purview. It should go to health ministry. It should go to DDHS. And ultimately, after 28 days, the file came back to CDSCO. Everybody says that it's not my responsibility. So it comes back to CDSCO. And the simple solution was that my PRO organization should have written to the lady in one day that, ma'am, this medicine is available coming from Roche, and this is the, we would have probably facilitated the lady, because she probably wrote in distress. We would have facilitated that, ma'am, this drug is actually sold by Roche. This is the contact number. You can call them and they will provide this. And it's not that we don't do it. When a Supreme Court judge calls, we immediately start reacting and doing that. So this is a problem of mindset which also need to change, when we have to actually start and develop an ecosystem, right? When I was in my previous role, we actually had a lot of trainings at Harvard on developing the innovation ecosystem in our company. And the immersion, the part of this whole value chain of innovation development, there is a process called immersion. And in healthcare system, when we are trying to develop innovations, immersion has a very important role. And within immersion, the process has that we go and spend one whole day with one patient at his or her residence, maybe a diabetic patient or maybe a cancer patient or whatever. So that, and we used to go and simply observe morning to evening that what is the routine of the patient. And in only 24 hours, multiple ideas would come that this is the point of intervention. Here somebody can intervene. This is another point of intervention. And every point of intervention was actually one idea where one startup can initiate the development of either process or product or whatever it is. So whenever we are trying to develop an ecosystem in patient-centric ecosystem, I think we all at our individual level would have to actually go into that immersion. May not be physically, but we from thought point of view, from mindset point of view, we have to go through that immersion exercise and wear that cap of the patient, where what are the points where intervention can happen to facilitate the patient's life, and whatever issues they are facing, how do I support the patient? And then the real ecosystem will develop. I'll take one example at the end, which is directly related to the patient's union. I also have a responsibility where I still hold the charge of Director of Indian Pharmacopoeia Commission, from where I came to this organization as DCGI. And there we are custodian of pharmacovigilance system for this country. Huge program, huge network has been created throughout the country. 701 ADR monitoring centers, as I talk, has already been registered and they are functioning in this country. Every state except I think one, which is Nagaland, every state has minimum one ADR monitoring center. But where is the problem? Problem is, and what is the responsibility? Job is to identify the adverse events coming out of the prescriptions, the drug being prescribed and patients taking the drug. If there is any AEs, it has to be reported back to the center in Ghaziabad, and then data analysis and recommendations happen to the regulators. But the problem today is 99.9% of reporting comes from either doctors or healthcare workers. We last 2 years, I actually struggled to bring in patients into the loop, that you directly start reporting. And with all due regards, when there is a healthcare worker in the value chain, there is a filtration happening on the adverse events, that what to report and what not to report. When patients start reporting directly, that filter is removed, and then the real information on the adverse events and real vigilance happens. And real advantage of vigilance happens when that crude data comes to us. We can actually know that what actually is happening. So people sitting here, this is a request, because most of you may not be directly from or maybe from the healthcare, but the people who are not from the healthcare side, directly involved, you should also help in promoting this initiative from Pharmacopoeia Commission and Pharmacovigilance Program of India. At wherever you are, in your individual capacity, if you are an NGO, you can actually, through your NGO, do some initiatives, improve the awareness among the patients or their family members that this is an important activity. And patients have to become a voice, a strong voice for asking what they need. And the initiatives have started, but certainly it needs much more push if we have to move to next level and get the real advantage. So it's a vast topic. I can go on speaking for the whole day, but in the scarcity of time, I would stop here. And thanks again, Rajendraji, for giving me this opportunity. And I'm always there, just a call away, if you have suggestions in this specific. And all the best for this patient union launch.